stem cell transplants. Unfortunately, Gordon got metastatic brain cancer, and then unfortunately we lost him in 2006. So about several years after that, I decided that I was going to give up a job that I loved, and I was going to go out and talk to people like you about ways to be more effective surviving cancer, caregiving, brain illness, and grief. And as you can see on the bottom of the screen, you can see my products. All 6 books now, thank goodness, and I mentioned that I am now on radio, and you can listen to me Monday, Wednesday, and Friday at 2 o'clock on www.w4wn.com, the Women for Women Network, and the show on Monday is Cancer SOS, and the show on Wednesday is Caregiving SOS. So I highly recommend that. We're having some great shows and some great topics. So what does it take to be a cancer caregiver for a senior patient? Why is a caregiver an important part of any cancer journey anymore? Well, it didn't used to be so prevalent, but now, because more cancer patients are surviving cancer now, and that's due to more intense and precise treatments. So it's always good to have someone by your side to help you to get through the jargon, so to speak. In Gordon's case, when he was going through his stem cell transplants, they would not even allow a patient to do a stem cell transplant without a caregiver with them 24/7. B, to be another set of eyes and ears for the patients. That's very important because there are a lot of decisions to be made. There's a lot of information that you're going to be hit with, some of it very quickly, some of it while the patient is still in shock, and in some ways so are you. Cancer changes your life. It's not like a lot of diseases where you can get a pacemaker and you can move on. So it's really good to have a good an extra set of eyes and ears to help. To also help schedule appointments and provide transportation, and to blow the whistle. Sometimes you have to, this is certainly a reason that you have to pay attention all the time. You may see something that doesn't seem quite right. Sometimes the patient is tired and he's been there waiting in the waiting room a long time, and you just have to say, help, this is not a good thing. So to kind of be the referee and keep everything going. So obviously the answer to that is most definitely all of the above. Today we're going to talk about building a caregiver toolbox. And basically, here's a tip from the toolbox. Which of these things are important tips to have a good blood pressure measurement at home? You can get a good blood pressure monitor, but if you, is it to have the patient put both feet on the floor? B, the patient should sit with the arm relaxed, extended, and supported. And C, the patient shouldn't talk while the blood pressure is being taken. And the answer is all of the above. And including the information that I researched shows that you shouldn't really even take the blood pressure unless over a shirt. So to get the best reading, these are the things that you should do, and the patient shouldn't be talking or eating or doing any kind of activity to get a good blood pressure. Now, in your caregiver toolbox, these are the things that I think are very important. You need a 7-day multiple section pill organizer like the one that I have pictured on the screen. I like that particular kind because you can actually take out today's meds and put them in your purse or your pocket to go to the cancer center so you have them with the patient. The other good thing that a pill organizer does is it allows you to fill it in advance, and that way you can see if you have any prescriptions coming up that need to be filled, because it's very important. In a lot of ways you feel like a pharmacist yourself. It's very important to keep the patient on regular medication and not let that drop. So it gives you a little hedge to say, oh, I got to call the pharmacist. Also, a good pill cutter. And that's not something that a lot of people think of. Sometimes you think, oh, I'm just going to take a knife and I'm going to cut that pill in half. Well, first of all, that's not very accurate in a lot of cases. And second of all, you could cut your finger off. And third of all, the other half of that pill could go flying across the room, and you might find Fido not feeling very good, or Fluffy, whichever you have. So it's always good to have a good pill cutter. They make them actually with magnifying, so you can buy them, and that way you can cut precise and you don't have to worry about the pill flying across the room. I recommend that you have an oral antihistamine, diphenhydramine, a Benadryl, or a generic form in your home at all times. I found this out the hard way. Thankfully, I did have it because when my mother was under hospice care earlier in the year, she was on an antibiotic, and I had just given her breakfast and her meds, and she says, Joni, she said, my tongue's getting numb and my throat is swelling up. So I ran, I got the phone, I called hospice, got them on the phone, and ran for the Benadryl. And thankfully I knew right where it was, and I wrote this toolbox list that day because I know you need to have Benadryl available at all times in case of an allergic reaction. Your patient's going to be on a lot of medication, and sometimes it's hard to know which one caused the problem, but you got to attack it. Latex or non-latex gloves of the proper size, for obvious reasons. There's going to be a lot of cleanups. There's always the possibility of germs, and you certainly want to cut down on germs. We're going to talk a little bit more about that later. You want them to be the proper size. You don't, for example, I wear small, and I have to sometimes you have to special order them, but you don't want your gloves flopping around or messing up if you're trying to change a bandage or something. Hydrogen peroxide rubbing alcohol, you would think that that would be a given, but hydrogen peroxide, do you know it's excellent for getting blood out of linens and clothing? Dab a little hydrogen peroxide on before you wash, and it's just a great way to do that. It's also a great cleaning agent. You can use it, you can give it to a patient to swish around in their mouth to help them with mouth sores. You can sterilize toothbrushes in it. So hydrogen peroxide has a lot of good uses. Rubbing alcohol, I can tell you, I washed religiously my sinks. Sinks will sparkle if you use rubbing alcohol, and it is a great disinfectant. You can use it on tubs. I even used a little bit with just some plain Dawn detergent to mop the kitchen floors. Again, with the goal of keeping down germs. My only caution with that would be don't use it around your stove or any electric. But rubbing alcohol can be a great tool to use. You have to kind of keep in mind that the smell can sometimes bother the patient, but it does dissipate fairly quickly. Digital thermometers with covers, those things are great, much better than the old-fashioned kind. Keep several in your counter so that you have them available to use. And a good, easy-to-use blood pressure monitor. I don't necessarily know any of the downsides of the wrist units, but I recommend the kind that is digital, that you use on your arm. And the great thing about those is they will keep track of the blood pressure of the patient if you ask them to, and then when the nurse comes around, you don't have to have penciled in the blood pressure of the patient, you can just say, here's the monitor. You can look and see it's been going up, it's been going down. So, paperwork. When should you ask the doctor or nurse for copies of test results? A, leave the paperwork to be stored at the doctor on a need-to-know basis. B, get copies of all blood work. C, you should get copies of all medical test results and blood work. The answer is C. I tell everyone that I talk to, always get copies of all medical test results and blood work. They are great for many things, and if you have to go for a second opinion, you don't have to go all over and collect a bunch of things. If you have to go to the hospital in the middle of the night, you can just grab your notebook with your medical test results and blood work, and you have the most recent. So it's a wonderful thing to do, so I highly recommend. You paid for, and if they try to give you any problem with it, here's the thing. You paid for those medical tests. You should be able to get copies of the results. When we went to UAMS in the University of Arkansas, at the Multiple Myeloma Center there, they provided, every time we walked in the door after the test results, they provided us, it was a book, but a list of the test results. Organization of paperwork is very important. You want to have a good calendar, whether it's a paper, digital, or electronic. I personally still have the paper kind because you never know when your digital equipment is going to go down. We just talked about having a 3-ring binder, a file folder for test results. You'll want to always have an updated current list of all medications, and that will change frequently, so you'll have to keep it up to date. And emergency contact numbers. Let's talk about that one for a few minutes. And I know it was really important to me. You'll want to make sure that you know when you have to call for emergency what number to call to get an ambulance that will take you to the facility that you're getting treatment at. In other words, if you just call 911, they will send an ambulance, absolutely, but it may not be going, if there's several hospitals in your area, it may not be going to the hospital where you're getting treatment. So you obviously need to do a little bit of advanced research on that. Find out what the number to call is for and have it programmed in your phone, and to make sure that your ambulance goes where you want it to. The book on the right is my book for organization. It's a journal, the Cancer Patient Win Book, our Cancer Fight Journal, and it has, it's available on www.basketofcare.com. You can order it there. And basically it has 18 oncologist visits. It's a journal that you can use, and it has a place for you to write down your prescriptions and the dosage, do you need a refill or not, a place to write your questions for the doctor, your next appointments. So it's a great way to stay organized, and instead of keeping an up, that's really technically your up-to-date list of all medications. There's another website I want to call to your attention that may be useful to you. It's www.mycarefolder.com. It's through an organization called Best Home Healthcare. It's a website, and they can send to you for, it's a small price, I think it's $14.95, and I'm not doing this to promote their stuff, but it's a great idea because they give you a folder that you can place on your refrigerator door with a magnet, and they send you pre-printed forms that you can fill out with all the health information, and where you can store all your medical information and be organized. And that way, whoever the caregiver is that day, if it's a different person than you, they have all the information, or in the case of emergency, they can just grab that file folder. Now talk a little bit about pain control. Is it better to only give pain medication for breakthrough pain or on a regular basis? A, the patient should only get pain meds when absolutely necessary. B, if pain is constant, the patient should get regular doses of pain medication to prevent breakthrough pain. And C, the patient may need regular pain medication also for breakthrough pain. And in actuality, the best option for pain control is once you get that pain leveled off, once you find that magic formula, is to keep that patient on a regular course of pain control and then also have something available for breakthrough pain. Sometimes cancer patients don't have any pain at all. My mother had lung cancer and she literally did not have that much pain. Now the morphine helped her breathe. That's another option. But you know, the thing is, a patient cannot effectively battle their cancer unless their pain is well controlled. Another pain control question. Often patients resist taking pain medication because A, they're afraid of becoming addicted, B, they're worried about what other people will think, C, they think they should just tough it out. A lot of patients, we hear it all the time, are afraid of doing any pain meds because they're afraid of becoming addicted. If your pain is real and you're taking pain medication for real pain, the likelihood of you becoming addicted is very, very minor. But if you're worried about it, just ask the doctor and you know, ask them what the options are. There's so many different ways of controlling pain now. Germ control, and here's a little question for you. You get home late from the hospital and the patient has a low white blood cell count. Your good friend Ada next door has kindly made you a nice hot chicken casserole. She shows signs of sniffing and sneezing but says it's her allergies. Do you, A, the caregiver can eat the casserole but the patient should not, B, bypass the casserole and make a tuna fish sandwich, C, they can both eat the casserole because Ada just has allergies? Well, you know, when we're talking about germ control, it's better to be safe than sorry, and neither the caregiver or the patient needs to be sick. And unfortunately, sometimes, depending on the situation, it's just better to be safe than sorry. Food for thought. Fluids and nourishment give your patient strength to battle their cancer. They'll be too weak to fight if the body needs more fuel than they're taking in. One interesting article said that if you feed yourself, you feed your cancer cells. That didn't sound very good to me, but it went on to say that healthy cancer cells are more susceptible to anti-cancer drugs than undernourished cells. I can tell you, my husband, quick story, after his first stem cell transplant, he looked at me after he was much better and he said, if you had shoved one more piece of food at me, I think I would have hurt you. But he knew why I was doing it, and his second and his third stem cell transplants, he did not argue with me at all, and we used high protein shakes when he didn't want to eat. I really, really loaded them up with a lot of good nutrition, fruits, anything that they'll eat. So we're talking about special needs of a cancer patient. We've obviously discussed pain control and germ control. By the way, with one other thing on germ control, kids and pets have no conception of germ control, and this is something that you constantly have to be aware of. When little Lucy, your granddaughter, comes to play and she's looking so cute but she's got a sniffly nose and comes up to kiss you right on the lips, sometimes you're just going to have to turn your cheek and let her kiss your cheek. She still gets to kiss you, but not so much on the mouth. The trick is, to keep both the caregiver and the patient healthy. Because if the caregiver gets sick, then for one thing, they could compromise the patient's health, but they could also have to call in the second string quarterback, and sometimes that's not a great situation either. Resting is very important for cancer patients, and they need to do it anywhere they can. A lot of cancer centers now have recliners so that the patients can rest when they're spending the hours that you may have to spend at the cancer center. So it's important they get plenty of rest. If they need something to help them sleep, then you'll need to work on that too. Depression, it's a lot of people have a misconception that depression is because of a mental illness. In this particular case, when it's cancer and you're on, say, for example, steroids, which are a medical depressant, you're probably not getting as much sleep as, or the patient isn't, as they need to, and probably the caregiver too. It's something to talk to the doctor about, because there is a difference between regular depression, clinical depression, and just being depressed because you have cancer. So I've heard different percentages of how many people going through cancer treatments take antidepressants, but I can tell you my husband did. And it's a lot. Food management, again, keeping the patient eating any way that you can, offering them foods that they like to eat, kind of knowing the secrets. Having cancer can be a little bit like being pregnant. Sometimes food smells bother them really, really badly, of things that they liked before they ever got cancer. And there is also cravings that go along with cancer treatment. My husband went whole months eating Cheerios. I mean, he just loved Cheerios. I have no idea. But food management is something you have to stay on top of, and obviously comfort too. You want to keep the patient comfortable, and that includes, sometimes you need to put a note on the door that says the patient is resting, come back later. Germ control, if it's cold and flu season, put that note outside on the door that says, we really, really appreciate you coming by, but if you're not feeling well, please don't fix any food, and please come back later. People that love you and care about you will understand, and they can certainly give you a call too. Caring for the patient. Recognizing your own intuition is a great tool that should be used daily. What is intuition? An appointment with Madame Rue, the fortune teller. You need to be a medium to practice intuition. Intuition is simply limiting distractions so that you can use your 5 senses effectively: sight, sound, smell, touch, and taste. Of course, that's what intuition is. And I can tell you, if you will open up your eyes and your ears, you can learn a lot about the patient. You can tell what's going on. Are they groaning? Do they seem to be a little more distracted? Obviously, you can tell mental issues with them as well. If they say, I just don't know if I can take this anymore, or why am I having to go through all this? So keep your senses alert, and they will help you to get through being a caregiver. Defining your resources, I recommend from the very offset, make a list of your resources, the people that you can think of that might be needed to help. For example, medical. Now, I'm not talking about the medical community here. I'm talking about people that you know in your realm that may work in a doctor's office, or maybe you know a nurse across the street. Sometimes it's nice to have that person around, your cousin Judy, who is a PA or something, that you can kind of bounce some things off of, discuss different options and ideas. And so make a list of those medical resources too. Family obligations, and what I mean here is when you're caring for kids, or in an older situation, when you're caring for your parents and they're not in an assisted living or nursing facility, you may need, once you take on the caregiving responsibilities, you may need somebody to help you with those family obligations. Personal, and that's your what I call your circle of friends. And circles of friends are so important. And oh, by the way, sometimes they have to be available 24/7 for you. Those are the types of friends that you really want, because I know a lot of cases patients don't like to see you cry. They don't like to see you emotional. So what you tend to have to do is kind of, wait until they've gone down for a nap or even gone to bed at night, and then call a friend and just, let your emotions go. So it's important to have friends available that can help you. Mental, including activities. You have to realize that there is a life outside of caregiving and cancer, and it can really wear on your emotional and your mental health. I highly recommend support groups, and what you're doing today. Just listening to this webinar is very important. But, most cancer centers have social workers and what have you available, counselors available to help you through your struggle. It's just up to you to ask for that help or to make the first step to be there. Organizations, obviously this is your church, this is the Shriners, the Masons, any groups that you're with that care about you and your patient, you can find some resources there. On the home front, and what I'm talking about here, most of my husband's cancer treatment took place 800 miles away from our home. And so we need somebody that would check on the house, pick up the mail, mow the lawn. So you need some help doing some of those items too. Financial. Bills have to be paid. The bills, they just don't care anything about what's going on in your life or what your situation is. So you might need somebody that you can trust that can help you keep all that stuff going. Information. Now, this is what I mean by information. I believe that information is kind of like an octopus with all of its tentacles going out. I'm from a relatively small town, and that's where my mother was when she was ill. And she had a lot of people in the town and through the church that cared about her. But there was no way in the world that I could get on the phone and call each and every one of those people, or I would have been on the phone 24 hours a day. So when you set up these information circles, appoint somebody. Appoint one person in the church that you talk to, one person among your friends, one person among this family, one person among that family, one person at work, and call those 5 people, and they need in turn to have a list of people that they contact. And information is really important because, first of all, the spiritual aspect of it, if you want people to be praying for you, they need to know what's going on. And I can also tell you that if they don't know what's going on, what you're going to find out is that some incorrect information might get sent around. So try to keep the information up to date. How to ask for help. So important. And people don't like to do it. I'll be the first to admit I'm as proud as the next person, but I have to tell you, this is not a normal situation, and this is a situation where you will probably need help. So start up that upfront communication with your resources. Ask them upfront. Give them kind of an idea of what you're going to need, the possibility that you're going to need them to do this, that, or the other. Distribute the need. Don't depend too much on just one person, or you'll wear that person out. A lot of people have jobs already, and they have families, and they have things to do. So try to spread the wealth out and let a lot of people know so that you can kind of take turns. Be specific about what you need. If Joe calls and he says he's coming by and you're thinking, well, I could sure use a carton of milk, and he says, well, is there anything you need? Well, I don't know. Yeah, I guess I could get a carton of milk. Well, do you need bread too? People want to help. People want to help you, but unless you ask for it, they're not necessarily going to be able to do it. How are they supposed to know? They can't read your mind. Map out your schedule to prevent last-minute needs. If you can, try to do as much scheduling in advance as possible so that you can kind of give people a heads up of what you're going to need and it doesn't leave you scrambling at the last minute. And lastly, don't look at no as a personal rejection or an end to the discussion. Now, that doesn't mean argue. That just means that maybe you can get that person the next time. And that's a great way to say it. Just if no, I can't do it today. Well, okay, well, I'll keep you in mind for maybe next time you can help out. So don't take it personally and just clam up and not ask anybody for help after that. Being the counselor, you are the counselor in a lot of cases to the patient. My husband used to ask me all the time, why did this happen to me? Once, the best quote that I ever read, I think, was by Arthur Ashe, and he said, if I was to say why me for the bad things that happened in my life, I would also have to say why me for the good things that happened in my life. Unfortunately, nobody has the answer to why yet, but their patient does sometimes need help getting through the mental and emotional strain, and of course so does the caregiver. So try to smooth through those rough edges together as a team, and certainly there's always have the pastor come by the house, or again you have the option of getting counseling at the cancer center usually. I'm going to close this up with the hope quote. This is my quote. Hope is a one-syllable word that will keep you going when all of the other more impressive words have failed to sustain you. You have to have hope to keep going. Again, I appreciate you joining in on the webinar today. I would like to call your attention to www.basketofcare and also www.jonialdrich.com. And I hope that today was informative and helpful for you, and that you will check out my websites and certainly take some of these tips. And caregiving is the greatest gift that you can give to another human being. It truly is. It isn't easy, but it's a gift. So I appreciate you tuning in today.